Healthcare plans are in the news this week, and while we aren't going to debate the pros and cons of the U.S. Supreme Court decision, we are going to talk about the timing of a piece of legislation sitting at Legg Hall in Dover. It calls for a single-payer health plan for the state of Delaware. The authors of the bill are here as our first persons this week: Representative John Kowalko, Democrat from Newark South, and State Representative Earl Jakes of Glasgow. Welcome, gentlemen. Thanks for joining us.
Thank you for having us.
And I guess we should start with the idea that this bill is going to sit. There's going to be, I guess, a time to sort of think about it over the legislative break at the end of June.
Well, you know, healthcare is a very difficult situation. It affects everybody, from the baby who was just had its first breath to people who are in their twilight years. It's a difficult situation. It affects everybody differently. So John and I are committed to working to help every resident in the state of Delaware, and that means even taking on difficult subjects such as healthcare. So that's what we're trying to do.
And did you know it was going to sit when it was introduced?
Yes, we introduced it so that we could get input. You know, we started with single payer only because we believe that might be the best system, but we don't know if it is. So we wanted the input from everybody, and we are getting input already, and we've already reached out to like the Chamber of Commerce, to our hospitals and all that for their input. We're going to have meetings with them to start to get input, and we want people to send us their ideas and how it does affect them, so we can try to resolve these issues and see what we can come up with.
What's the motivation behind this?
Well, the motivation is, for about 7 years now, even before I was in office, I was working with groups of people and Dr. McDowell, Floyd McDowell, on a single-payer system. I'm a firm believer that our healthcare access to healthcare, the insurance system for healthcare in this country, is broken, and that we can never adjust or administer a fair accounting of the healthcare that's provided to us unless we clean up that mess at the beginning of the gate. That's the insurance industry access to healthcare. All Americans have the right to healthcare access. And we provide it to all Americans, actually, if you go to the emergency room and all that. But the costs are so high, and the cost of premiums mirror that because they say the recovery costs from the other things. So single payer, in my mind, is the most logical way to go. I supported the, I forget what the resolution was, but it was for a national single payer health care program. And I supported that, and I wrote a letter in support of that. But if we can't accomplish that now, then we have to go at the state level, I think. And you asked a very significant question: why are we introducing this now? I was thinking about it on the way over, and I like to think of Representative Jakes and myself as the architects of a project. We put together the plan. We made sure that it's a 5,000 square foot, so we have 5,000 square foot of lot space. Now we are at the stage where we're going to the Development Council, the Land Development Council, all the technology departments that have to say, will this work, will that not work, what about this and that? So the plan is there. The plan is a rough outline plan, and everything that has to be answered about this plan moving forward is best answered over the course of a 6-month period. And then when we come back in January, and we have, hopefully, and I know we will have hundreds, maybe thousands of questions or suggestions and all that, and we integrate those in, the logical ones, then we are in a much better position to move forward with a responsible look at implementing a plan such as single payer. It's a very complex plan, but it's not a reformation of the entire medical provider system. It's a reformulation of the healthcare access, the insurance availability of healthcare. And one thing that we are agreed upon, I think everyone, that all Americans should have availability, access, and affordability of healthcare.
And you said you're hoping for hundreds, maybe thousands of questions. I think probably one of the biggest questions people have whenever it comes to anything that deals with healthcare and reform: how is it paid for?
Well, one of the things that we did when we first decided to get involved in this, and we looked at single payer, in Dr. McDowell's bill that was introduced about 5 years ago, we looked at it, had some numbers in there, it had some percentages in there. We sat down with the Secretary of Finance and also with the Comptroller General to run those numbers to see if they really did work, and they actually do work. We were kind of surprised that they worked, but they do work, and so you know, that's a starting point. We want to look at that. We want to reach out to businesses and see how it affects them. You know, double-digit cost, rising cost of healthcare to small businesses, and I know John's been really pushing on that, is just unattainable for the small business. There are less and less people are providing health care to their employees. we got to address that issue, and it'd be good for businesses. So I know John has a lot to say about that subject because that's his forte.
Well, and you mentioned businesses, and when the federal health care law was passed, a lot of the cry was from small business owners, how are we going to be able to afford this? We're going to have to lay people off. How does this fix their problems?
Well, right now, the people that do provide some kind of health care for their employees they have the deck stacked against them. They're paying an enormous amount of money, and for themselves. A lot of small businesses can't even afford health care for their owners because they can't afford it for their employees. And it puts them in a quandary. How can I be fair and honest to my employees? If you have the mandate, this is the advantage of the Affordable Care Act that's coming into play. The mandate will dictate that businesses have to provide health care or pay a fine of substance. If our numbers, which we vetted as accurate enough to carry this program in Delaware, if those numbers, payroll tax percentage numbers, in your particular function as a business person, if you have X employees and your payroll tax is X percent, you could compute that, and if it's cheaper than the mandate, if it's cheaper than the fines, then you want to be all in on this because we're giving you health care access for your employees that you no longer have to deal with. You no longer have to pay any health care costs. You don't have to pay deductibles. Your employees don't have to pay any deductibles. So it's this one bill. And what it does, I talked to the ShopRite people, Rich Kenny, when he was in, and I asked him to do a workup 5 years ago. I said, do a workup on this percentage that's in this bill that we vetted, and compare it to your existing expenditure for health care costs for your employees, your end of it. He came back, and this was 5 years ago, he said, I'm break even now. The next double-digit increase, I'll be making money with this plan. And that's what we have to do, hit that provable numbers. We have to have those accessible to people so they can look at it so that the business community can say, I've done it. I've done the math. This is going to be a cheaper way for me to provide health care for myself, my family, and my workers, and it's going to take that off my mind. I'll be able to deal with getting good employees here. The ones that are going to, and that have questioned, and both sides of it they've questioned, have been the ones that don't provide health care. But there's also a large group of them that would like to provide health care. It gives them a competitive advantage. So you say, I have no bill now. So why should I want to pay into this thing for my, well, two things. One, you're going to get a much more reliable employee. Two, it's going to be much cheaper. And three, if you have no health care now for your employees, you're probably paying an enormous amount just for your own family's policy. So this is going to relieve that. I hope that people will do in their own circumstance the math, including the individual. An individual, tally up your copay, tally up what you contribute toward your employee share. Tally that up, put it down on a piece of paper, then go to this bill, calculate what that tax will be in there. And if it is less than that tally sheet, you're gonna be okay. And you have nothing to fear. And that's the problem with changing. When you change, you make a tax, and people say, well, you're going to tax us. Well, we're displacing an expenditure that is no more than and no less than an actual tax on you, and that's the health care cost for your health insurance. So we're displacing that. We're not making a new one, even though you can always argue the prospective semantics of it. But the fact is, the reality is that we have vetted those numbers. Those numbers are going to be able to bring in enough revenue to pay for the ambitiousness of this plan. And now we have to have people do their homework, find a flaw. We've already gotten dozens of questions, serious questions that we're working on answering. But I want everybody to be comfortable with the next step. That's when we move forward with the intimate details. Let's get all of the big questions out of the way, and let's answer them, though, not just shut them aside.
Have you had any response from the governor's office on this?
No, not yet. We have not yet. But, to follow on to what John was saying a little bit is I had a call yesterday from a lady who said, I don't want to pay for the uninsured. And I said, you already do. Right. Every time you go to the hospital, that is added onto your bill because they're going to the hospital. And that somebody's got to pay, so that just gets added onto your bill. So you're already paying. You just don't realize you're paying. So,
How did the two of you get together on this? What brought you together to work for this?
I want to talk about that one because I told Earl, and Earl knows I get very emotionally attached to trying to do things that I think are right, and sometimes that's not efficient or productive if you don't have someone there who is going to look at it in the perspective of reality, every detail. Earl's a retired military man. He's a general. Earl has that mind, that organized mind, that doesn't sit back and say, well, Kowalko said this is good. And he had a big smile, so it must be good. No, Earl sits there, and it was deliberate. When I talked to Earl, I said, I'd like you to join me on this because I need your personality, your mind that is not unwilling to just say, well, we can look at the page 1 and assume page 2 is there. No, Earl wants to look at all pages. And I think that's a valuable asset for someone like me who's more or less theoretical and philosophical and trying to do things, but knows that there's an answer there, but is maybe too hyper to look at the details. That's what Earl brings to it, and I mean he does a good job of that.
We're a good team. I mean, really, I do the practical side, and he does the moral and all those type of issues. He brings them forward to me, and things that I don't think about, he brings forward. And so we're a good team. We play off each other all the time. We've done a couple other things together, and this just seemed like an item that both of us wanted to really address. We campaigned on these issues, when we were running. And so we finally decided, hey, we really need to start tackling this issue. It's a big issue. We need to bring it forward. It's in the news. Let's start figuring out how we're going to go here. And we don't know if we have all the answers. We just thought it's time to start addressing this issue and see if we can make life better for the residents of Delaware.
And finally, odds that this gets debated on the floor next year?
One thing, we did get already a commitment from Representative Barbieri, who's the head of Health and Human Services, that we are actually going to do public hearings up and down the state. He's already agreed to that. We're all set to do that. That's why we're trying to get these questions in, and we're really asking the public, please send us your questions, legitimate, down-to-earth questions. We get a couple every day, but we need more and more so we can start venting through these and try to answer some of these questions so that when we come forward to these public meetings, we can lay out what really can happen and how it will really work. And then take some more questions, obviously, to figure, because it affects everybody, and we want everybody to be able to have a part of this.
And most likely we haven't heard the last of this. Representative Earl Jakes and John Kowalko, thank you very much for joining us on First.